welcome to our power panel today, Healthy Living for Brain and Body. We're going to spend the next hour together, starting out with a little introduction now. For about 15 minutes each, we'll have our panel speakers speaking on specific topics. So we're going to start out with Dr. Piero. Virginia Sherpa will follow, myself, and then Alyssa Reyes is going to close full circle, bringing us back to the longest day and some additional information that can really support this space. We'll save all of our questions for the end. We'll have about 10 minutes. So if there's anything that comes up when any of us are speaking today, please feel free to write yourself a little note to save those questions for later. We want to make sure that we circle back to those as well. And then for the duration of this meeting, please feel free to mute yourself so we have clear audio. We can hear all of our speakers. And again, any questions, please save those for the end. So welcome. We're so glad to be able to be here with you today to share this valuable information around Alzheimer's, dementia, and brain health. And I think there's going to be some really supportive educational information that you'll hear today, some very supportive information about lifestyle changes. And then we're going to close with some information on somatic breathwork and mindfulness and how these practices can support both caregivers and patients. So on that note, I will roll us over to Dr. Piero for some facts on Alzheimer's disease.
Yes, good morning. Thank you. And welcome everybody to this conversation or this chat about Alzheimer's disease. And my role is to set the stage to mention a few things about this disease, which has been the focus of my work as a neurologist at the medical college for most of my life, really. And I find it extremely interesting, this part of neurology, because it really looks at the interface between brain and mind and what really makes us special compared to other people, this uniqueness about our ability to think, to elaborate information, which defines who we are. We are just the result of our stories, of our experiences throughout life, and that makes us unique. With this disease, with dementia, with Alzheimer's disease, really, we see a dissolution, a diminution of what really makes us an individual. And in that respect, it really affects not only the patient, but all the people around them, like caregivers, family members, as we know because of personal experiences or even because of a professional experience. So I will give you some concept about what is Alzheimer's disease, and then show you how these basic concepts actually are now being translated in clinically relevant changes and problems to some degree in managing people and families who have to be confronted with this disease. Next slide. I'm not going to elaborate on the symptoms of the disease because especially caregivers know that the diversity of symptoms that can appear in this condition, which it's very insidious at the beginning. And here you see a list presented a few years back by the Alzheimer's Association in the early signs of the disease. And you see two signs which are at the bottom of this list should actually be the very first ones, because those are the first things that change in somebody who's developing dementia, which means cognitive change, of which one of the types is Alzheimer's disease. The first changes are personality changes, loss of initiative, apathy, we call it. And frequently we see that these changes can occur in elderly people who are going through health issues, financial issues, friends are dying, and of course they are depressed. Of course they are less extroverted compared to before, but frequently these signs could be the very beginning of a cognitive change, which is seen by the people around them as they are not the same. Then eventually, as time passes, this cognitive change starts to affect the activities of daily living, their ability to make change at the supermarket, the ability to remember deadlines, paying the bills, especially abstract domains seem to be affected before the more kind of common physical routines such as dressing and cooking and activities around the house. You can imagine how different we are as people in our experiences and how difficult it is to make a diagnosis depending on your routines If it were a broken bone, for instance, it would be easy to look at an X-ray, and I don't care who's the owner of this broken bone, it's broken. When it comes to dementia, you have to put things in perspective. You might deal with a person who has very little education, and they, like it happens at times, people who are illiterate, and you realize that the questions, the interaction will be very different from somebody who has had high education and is very well knowledgeable about current events, compared to somebody who is illiterate and has problems drawing a face of a clock. So that's the big challenge from a diagnostic point of view. May I have the next slide? Very good. So this is a picture I wanted to show you about the brain. This is 1 millimeter of cube of brain tissue. And you can see how rich it is of nerve cells. And we discovered that they all have different functions, incredible connections. And sometimes they are twin neurons which talk to each other, and they look really identical. It's extremely complex area of the brain. This is just 1 millimeter, which is the smallest space you can make between two fingers without touching them. You can imagine the complexity of this organ, the brain. And in this 1 millimeter, there's 57,000 brain cells with 100 million synapses, and can cause so many variable connections among themselves, which is like the memory of one of the most complex computers we can actually use today. We have the next one. Next slide. And if we look at more closely to one brain cell, you can see that it has a body in the center, and then it has a large expansion from it, axon it's called, which looks like a tooth that goes up, and you can see like what happens with an incredible connection with all of the other cells, which is how memories are formed. And with aging, there's a pruning of these branches physiologically, and we can explain why we grow older. Even memory is not as good as when we were 20 years of age, because there's some physiological changes that happen normally. Next slide. In Alzheimer's disease, however, things change, and what happens in that long tube that comes out of the brain cell is kept together by these red proteins called the tubulin associated protein, or tau, T-A-U, which keep the thing together. In Alzheimer's disease, some molecule of phosphorus appears, and they tend to dislodge this protein, creating a free protein, which leads to the dissolution of this structural part of the brain cell and brain cell death. And the next slide. And a second lesion, which has been historically very important in Alzheimer's disease, is another protein called APP, which is stuck in the width of a brain cell, and we don't know really what it does. It does different things. But then eventually, like all protein, is recycled in the brain and is cut in this location and then in this location to create a free floating protein which is eliminated. But in Alzheimer's disease, it's cut in the wrong place. We don't know why. And it creates a protein which is different. It's got this little thing attached to it, and it kind of clumps together, and it causes what's called a plaque. Next slide. So these are the two lesions. The one is the tau protein, or tangle, and this is a plaque. It's a picture of it. This is a kind of accumulation of this beta amyloid protein, which the brain does not know how to get rid of. This is also age-related phenomena that we accumulate with as we grow older, protein which we need to get rid of. For instance, I have age spots, which I didn't have when I was 20, because I'm losing the machinery in the cell to get rid, in this case, of another protein, which it piled up with age. A similar phenomena happens with amyloid in the brain, which leads probably to the development of Alzheimer's disease. Okay. May I have the next slide? We can actually now develop inject in a brain of the person, for instance, a sticky protein that goes to this amyloid, so that you can actually look in the brain scan and you can see the pictures here. This yellow stuff is amyloid accumulated in the brain. So we can actually see now the amyloid in the brain, and it can help us in making a diagnosis. But what we have also discovered at the same time is that there's a large number of people, around a third of the people age 65, that go around no dementia, but they already have this amyloid in the brain. That's interesting. But we knew this already 40 years ago when we started studying this protein. We realized that this doesn't happen magically on an afternoon because the doctor says you have Alzheimer's disease. It's a process to form this plaque that takes 10, 15, maybe 20 years. So now we have people who have amyloid but don't have the disease. You can have the amyloid but not have the disease, but you might have it in the future, depending how long you live. So this offers us a window of opportunity to intervene before we see the symptoms. And this is a key phenomena which has developed in the last few years. It's like saying in the old days, we used to wait until somebody would have a heart attack to figure out that they had a bad heart full of cholesterol. Now we know that it doesn't happen suddenly. You accumulate cholesterol, you accumulate because of many other reasons, but you have a window of intervening with diet, with exercise, even with medication that can reduce the risk of infarct. Now we are finally arriving at this frontier in Alzheimer's disease that we can do something about this disease if we can figure out people at future risk. My mother had Alzheimer's disease. My mother's aunt had Alzheimer's disease. I am at higher risk. If I do a blood test, I'll tell you about that later, or this scan, I could find out I have amyloid, but it's not a determinate risk. It doesn't mean I'm going to get it. It means I'm at higher risk than my friend who doesn't have amyloid at my age, as this picture shows. May I have the next slide? So this protein in the brain has actually now been measured in the blood. When we measure it in the spinal fluid of the brain, it's easy, or it has been developed over the last several years, I would say maybe 10 plus years. But the blood is 700 times thicker than the spinal fluid. So imagine how difficult it is to go and pick the presence of this little tiny protein in the blood. But that has been done recently to the point that now we have a blood test and actually been approved by the FDA last month for the diagnosis or help the diagnosis for Alzheimer's disease. If you have a positive test, it's not the end of the story. You still have to get other tests to verify that it's not a false positive. A worse thing about doing a wrong diagnosis of dementia or Alzheimer's disease is actually tell somebody that they have dementia or Alzheimer's disease when they eventually don't have it, because it really, let's say, changes one's prognosis and perspectives about life. So this test is available. It's available and it's administered to people who already have the diagnosis of dementia to help us distinguish who has an amyloid type Alzheimer's disease dementia from people who have a dementia because they drink too much, or because they have had head trauma, or because they are depressed or anxious, which can also present with a memory problem. Next slide. And now we have actually medications which can stick to this amyloid and remove it from the brain and from the blood vessel. May I have the next slide, which probably goes into this concept in more detail. And the reason I'm showing this, because now we have, in the old days, we knew something was wrong in the brain, but it didn't have any clinical applicability. Now we have a diagnostic test. Now we have actually a therapeutic intervention. And you can see how it works. It's given in the vein. One day will be given by mouth. This protein, this medication, which is this little white wise as an antibody that sticks to the amyloid and removes it from the brain. So this actually removes it from the blood, but then more will come out of the brain into the blood, where this medication will remove it from the body. So it can stick this medication to the molecules, or it can actually stick inside the brain to the plaques already formed to remove it. What's the problem with this medication? Which there's two of them on the market. It's very expensive. They cost around $26,500 a year per person. They have side effects. Approximately a third of people might have some mild hemorrhages, small hemorrhages, or brain swelling, so the people have to be monitored. People who have cardiovascular or cerebrovascular disease might not be eligible because of the tendency of the hemorrhages. So the people who are eligible for these new medications, it's a very small number of people. But this is an important step in research which advances in small steps. One day, as I mentioned, these medications we give them by mouth. It will not have these side effects, but will be able to help us. It's a necessary step to move on the research for drug therapies in Alzheimer's disease. So two concepts are important, I think, today in Alzheimer's disease. Is one, that we have a disease that is not a disease of old people. It's a disease of middle age. It starts at 45, 40, 55. It shows when you're 75, because today, so many of us get to be 70, 80 years of age. And in the old days, just like we didn't see cardiovascular disease because life expectancy was 45, 50 up until 200 years ago. Then when we extended that, people started having cardiovascular disease. Now the envelope is pushed so far forward that now we see that actually the last frontier is the brain that unfortunately was not developed to live 80 years, but most likely 30 or 40. But we are moving into this penumbra of preclinical period of the disease, which is a very important target that we need to develop medications for people at risk, or maybe lifestyle that can probably improve or reduce the risk of contracting dementia later on. And I think this is my last slide, and I'll hold my peace.
Yes, thank you, Piero. As you see, my name is Virginia Zerpa. I have worked with Alzheimer's Association now for 14 years, doing a lot of education, doing one-on-one with families to understand the disease and help them to better care their loved one who is living with Alzheimer's or other dementias. Next, everything that I'm just going to share with you today, the strategies to help Nest, slide please. Everything that I'm going to tell you today is based on clinical trials. So all the information have come out of research. And Alzheimer's Association, we are a nationwide organization, and our vision is a world without Alzheimer's. Next. And we do that by, we are the largest nonprofit organization in the world that fund research, and we're actually third in amount of financial assistance to over 60 countries. We provide funding to researchers, and we are the third largest funder. First is the government of China. Second is followed by the United States government, and then us. So our mission is to provide funding so that we can find a cure or better treatments. In the meantime, we do provide care and support to families and individuals impacted by Alzheimer's and other dementias. Like this presentation today, our goal is to increase concern and awareness about this devastating disease. And we also have an office in Washington, D.C., where we advocate to our legislators to increase funding and to support efforts to provide better care and assistance to families impacted. Next. So we have educational programs like we're doing today. We also have high-level education programs for families who are taking care of a loved one with Alzheimer's. We have an online training for professionals in the field. We have a 24-hour helpline, 800-272-3900. Anyone can call us at any time with any questions in regard to Alzheimer's and other dementias, resources. And then we also provide, you can call my colleagues at that number and they will help you with information, referrals, and care consultations. Nationwide, we have support groups that anyone can attend, and as well as online community support groups, online training that you can access anytime. And safety services, I'm sorry, I forgot to take that off. We no longer provide that services. That's now Medical Alert provides these safety services. So my mistake for leaving that on the slide. Next. Next. So be aware that everything that I'm going to tell you today may work for one person, but not for the next. It depends on our genetic makeup. But overall, as a population wide, it has shown to reduce risk for Alzheimer's and other dementias. Next. So we all age, and that's not something we can control or stop. And we also, we have our own genetic makeup that we don't have much control over, but some of our genes, depending on where our environment and our lifestyle, can be either turned off or remain off. So we have, so the genes, our genetic makeup don't work in isolation. They work alongside the environment that we live in and our lifestyle. And our lifestyle, we have control over it. Some people more than others, but we have some control over what we do day in and day out. Next. Age is the most well-documented risk factor for Alzheimer's and other dementia. 1 in 9 people 65 and older will present the disease, will live with the disease, and once we turn 85, 1 in 3 people will live with Alzheimer's and other dementia. But as Dr. Antuono mentioned, that this is not an old age disease because the disease starts decades before the first symptom appears. Next. So there is a strong connection between the brain and our heart. We know that every heartbeat sends 20 to 25% of that blood straight to the brain, and brain damage can occur within minutes of the heart not beating, which can cause brain damage and put people at risk for Alzheimer's and other dementia. Next, so whatever is good for the heart is good for the brain, okay? They have intimate relationship. So we also, the Alzheimer's Association, we are the only organization that hosts a global international scientific conference every year. And 2 years ago, the studies were presented that show the connection between blood pressure and brain health. It shows that a blood pressure of 120/80 and lower was very beneficial to brain health. So very important to keep up blood pressure at a good number, a good level. Diabetes, people with diabetes also are at a high risk of developing Alzheimer's. As well, people who are overweight or obese are also at a high risk of developing Alzheimer's and other dementia because of inflammation, because they are at risk for developing diabetes. They also can present hypertension, which all of these put us at risk for Alzheimer's and other dementia. Sleep is very important for brain health. Clinical studies have shown that we need 7 to 9 hours of deep sleep to maintain brain health. Smoking is very damaging to brain health, as well as alcohol and high alcohol consumption is damaging to our brain health. Next. Next. I'm sorry, but that was just to show you the amount of blood vessels that we contain in our brain, and showing that the brain does require a lot of oxygen and nutrition to function optimally. So 4 brain health factors that have been studied in clinical trials are physical activity, nutrition, socialization, and mental stimulation. And I will start with physical activity next. And I'll start with physical activity because over 1 million people have participated in clinical trials that involve the impact of exercise in our brain health. And clinical trial after clinical trial have shown the same results. A tremendous beneficial impact on our brain health. There is nothing that can do what vigorous physical exercise does to our brain. First, it increases our level of the BDNF, which is brain-derived neurotrophic factor in the brain, that not only increases our cognitive reserve in the brain, it also has shown to create new neurons, especially on our temporal lobe side of the brain. It may develop new neurons, increases connectivity between our brain cells, increasing our cognitive reserve. So there is nothing that does that besides physical exercise. There is no single recipe, meaning that people can do what they love, okay? They can swim, they can go biking, dance, walking, brisk walking, jogging. So everything that raises our heartbeat is good for our heart. As a matter of fact, a recent clinical trial done in Madison, our Alzheimer's Disease Research Center, show that people who does 3 times a week, 70 to 80% of heart rate, 30 minutes, 3 times a week, shown to have a greater benefit of to physical health, to our brain physical health. So the more vigorous exercise, according to this clinical trial, the better off our brain experience, better outcome for our brain health. Next. So the CDC have recommendation for people who are 60 years of age and older. They recommend 150 minutes per week. That translates to 30 minutes 5 times a week, and with an increased heart rate level between 60 to 80% heart rate. And that includes aerobic machines, walk, like I mentioned before, bicycling, dancing, anything that increases our heart rate. They also recommend people to do 2 or more days a week of muscle strengthening, because that will support your cardio activity, okay? That also will help you prevent falls, okay? So next. Now I'm going to talk about nutrition, which also over 1 million people have participated in clinical trials, that is nutrition clinical trials. And this is a picture of the Mediterranean diet. The Mediterranean diet has shown to be very, very beneficial to brain health. And there's another study that studied the MIND diet, and the MIND diet is a hybrid. It's a combination of the Mediterranean diet and the DASH diet. The DASH diet was developed to treat hypertension. And the MIND diet is a list of foods that have shown to reduce a risk for Alzheimer's, Parkinson, cardiovascular disease, and cancer by 35%. So, this include foods like dark green leafy vegetables, blueberries, walnuts, fish like salmon, tuna, mackerel, olive oil, bright colored vegetables like broccoli and tomatoes and bell peppers. Including all these foods in our diet will help us protect and reduce our risk for Alzheimer's disease. And as you can see on the bottom of the pyramid, they include daily physical activity, because also of the importance of including physical activity in our daily lives. Next. So staying mentally active, very beneficial as well. So learning new things every day is very important. That increases our cognitive reserve. The higher the formal education we have, it has shown on a population level to protect us against dementia, any type of dementia. So even when we retire or we're out of school, it's important to keep learning new things, to keep having our minds engaged in learning new things. And the thing is that they're challenging because the brain is very good at once we learn something and become good at something, it's not challenging anymore. It becomes almost automatic, like driving, riding a bicycle, it becomes automatic. So we need to introduce new things so that our brains is challenged cognitively. Next. So reading books of all kinds of topics, playing games strategic in nature, like chess and bridge, or just playing cards with friends to engage the brain. Learning new skills, like learning how to play a new instrument, learning mechanic, learning how to sew, learning a new language. And as a matter of fact, they say that people who speak two languages or more have a higher cognitive reserve and also serve as a protection against Alzheimer's and other dementias. So keep learning new things. Next. And then finally, clinical trials have shown that being socially active is also very good for the physical health of our brain and also our mental health. So, but that means visit with family and friends if they're very nice. Don't go visit families and friends who are toxic to your health. So good, nice family friends, nice family members, and nice friends. Okay, that help you learn new things, that make you feel good about yourself. So volunteering, we always are looking for, the Alzheimer's Association's always looking for volunteers and keeping a purpose in life, okay? But then there are new studies that are saying that being socially active and engaging in a cognitive task and a cognitive engaging task is better than doing these two things only. So let's say, do you remember those things where you can go and paint? So you're surrounded by people, being social, and you're also painting, right? So they say that activities that combine both they're even better than just doing one or the other. Next. So beware, be a savvy consumer. If it is too good to be true, then it's not true. So if you have a question about something, they are 24/7 helpline. Please feel free to call us and we can help you. We can give you an answer to your questions. Okay, next. So yes, we are a nationwide organization, so you can find us anywhere in the United States. You can join our walks. For example, the state of Wisconsin has 27 walks that you can participate and help us raise the needed funding for research so that we can find a cure and better treatments. Help us advocate to our government or participate in clinical trials. I myself participate in 4 clinical trials and I love every minute of it. And I feel proud because I am helping advance the science as well. Next. And I think this might, okay, so here again is our 24/7 helpline, so feel free to call us at any time. Our website is full of information, and this alc.org /WI, you can find our schedule of virtual classes, in-person classes, as well as where all of our support groups are located in the state of Wisconsin. Our alc.org CRF is our community resource finder, where you can find long-term care services, physicians, all kinds of services, in-home care services, our support groups, our education programs nationwide. You just type your zip code and you can find a list of services near you. And our training, alc.org, provide online education that you can access 24/7. And I think this is my last slide. Thank you.
Thank you, Virginia and Dr. Piero. Again, my name is Morgan Hallenbeck. I am the founder of Back to Eden LLC, and I am a trauma-informed somatic breathwork facilitator and nervous system regulation coach. So very excited to share this information with you today. Also diving into some clinical studies and some research about how breath can support our brain health in general as we grow up through these younger years, as we hit that middle age tipping point, and then even as we age or we progress into Alzheimer's and dementia to find support within these practices. So, Alzheimer's disease, as we know, affects more than 6 million Americans alone, and it's the most common form of dementia, progressively impairing memory, cognitive function, emotional regulation, and quality of life, like we've heard about so far. So there is a beautiful way that we can approach this disease in the body with somatic work. Somatic meaning body-based. We're going through the lens of this vessel, this system, versus the lens of the mind to support that cognitive function and longevity. So emerging research has shown that breath work and mindfulness-based practices, think about your yogis meditating, Eastern practices that we see with monks and in spirituality, where there is this place of silence, of openness. There's an internal focus, an awareness on self that is beyond external. So when we enter practices like breath work and mindfulness, these somatic practices can offer really significant benefits, not just for preventing brain disease and dysfunction, but also for symptom management, for nervous system regulation, and caregiver support. Remembering that Alzheimer's and these diseases, our brain health is so much bigger than just the person diagnosed or affected, right? We have family members, loved ones who are often supporting us, caregivers, people that we're maybe welcoming into our life to be there to help us through some of these challenges. So our breath is a powerful regulator of our nervous system, and in particular, our autonomic nervous system. The breath is the only thing within our body that is both subconscious and conscious. So think about it this way. As we breathe and we move through every day, we don't have to remember to take every inhale and every exhale. Our nervous system is doing that for us. What happens here is that when we encounter stress, fear, emotions, different stimuli in life, which is going to happen when we're out in the world, even when we're in our home, that the brain starts to change, our nervous system starts to shift, and we can get pushed into these places of stress and heightened dysregulation within the body. So through conscious breath work, a specific breath pattern for a specific period of time with maybe an intended outcome attached to it, we can shift out of these chronic stress states and into a parasympathetic state within the body. This is our rest and digest place, the place we feel peace, we feel joy, happiness, contentment, where our sympathetic state can be more of a heightened arousal state, where we're experiencing intensity, anxiety, high stress, uncertainty. These are the things that kind of shake us to our core and make us feel unwell, just as we are existing in our bodies during the day. So healing the breath can support both physical and neurological function. When I first start working with clients, one of the biggest pieces I suggest looking at is one of the smallest pieces we can look at. How is your body breathing itself on a day-to-day basis? What does your natural breath pattern look like? And can we invite in breath awareness throughout the day without forcing, fixing, or changing anything, simply to notice where our body is at? Oftentimes, we're busy moving through life, we're distracted by other things, and so we don't have this time to come back to the body and really check in and go, how am I today, really? And to sit in that with honesty and truth. And at the end of the day, that might be that sense of overwhelm that I've done too much. Maybe I pushed the limits and now I'm looking to kind of collapse into my couch or rest for the evening. And oftentimes, that rest that we reach for isn't true rest. It might be zoning out, avoidance, finding something that feels good. Maybe there's some eating behaviors in there as well. But next slide. All right. So breathing and the brain. Why does it matter, especially for people with Alzheimer's? When we experience this disease, respiratory dysfunction is one of the most common symptoms, in addition to the others that we've heard about today. So there's often this shortness of breath. We're taking a few steps, we're doing a little bit of activity, and I can't quite catch my breath. Maybe I'm taking some big inhales and exhales. I'm struggling to feel that really getting into my body. The other thing is sleep disordered breathing. Things like sleep apnea. We might be using CPAPs or OSA. Shallow chest breathing and muscle weakness is another dysfunction we can experience. Oftentimes, we're breathing in the top 4 inches of our chest, and this is common for most people living in today's society in a high stress environment. Our breath stays in those top 4 inches of the lungs. We're not getting it down, that full expansion of all of this tissue that connects to diaphragm, connects to our pelvic bowl, our psoas muscle, our digestive system. There's a reason in breathwork we want to palpate and stimulate the diaphragm because there is so much connection here, both neurological, within our fascia, and especially within our vagus nerve, which essentially runs from brain. Picture a little tree with a ball up top and roots coming down similar to our neurons. That's kind of overlaid over our body and what our vagus system looks like. It's interacting and communicating with various parts of self, making sure that these different systems are functioning together, they're in communication, they're working properly. So these dysfunctions can be exacerbated and cause symptoms like reducing oxygen supply to the brain. We get less oxygen to the brain, we have less cognitive function, we have less ability for repair and creating new neurons, new neural pathways within the brain. It can contribute to poor sleep, and it also increases inflammation and oxidative stress. So that feeling of being puffy, that constant soreness, the tiredness, maybe there's some fatigue in there as well. So when we talk about the management of these common Alzheimer's symptoms, there are a few that I want to touch on. The anxiety and the agitation. Slow, deep breathing has been shown in trials to activate the body's relaxation response, that parasympathetic part of our nervous system. And it helps to calm the mind and reduce the agitation. So if we're at a level 10, where we're having an outburst, whether that's with self or a loved one, we can turn to breath to titrate that agitation down to help offer some support for relief, for bringing body back to center, back to a place that's more within those homeostasis boundaries or our window of tolerance, what feels good, what the body knows as familiar and safe. Our sleep disturbances. Breathwork can improve our quality of sleep by promoting relaxation, reducing symptoms of sleep apnea. Oftentimes, if we are mouth breathing and we have a clear nose, we don't have a deviated septum or other issues that prevent us from breathing through our nose, we can use lip tape to prevent that breathing through the mouth, start to retrain our body to breathe through the nose in a healthier, more natural way. When we breathe through the nose, not only does it signal down regulation to our nervous system and safety, but there are some very key mechanisms within there. We have little hairs, little follicles that pick up on bacteria, other things entering our body. It acts as a filtering system. The third, mood swings and depression. So regular breathing exercises can help to stabilize our mood by balancing the autonomic nervous system and reducing stress hormones. Oftentimes when we participate in meditative practices or breath work, especially longer practices, there can be an emotional connection or an emotional arising within the body. So as we're meditating and offering our body maybe a little reset, a release, maybe there is some tears that come online. And science has shown that when we allow those tears, that expression to come to fruition, we get to empty out the body. The body always keeps score of past traumas, ruptures, intensities, maybe emotional cycles that had previously been thwarted, that are holding that dis-ease within our body that also contributes to eventually, when it's not addressed, becoming disease in the physical body. So down-regulating our nervous system, helping those mood swings, helping those depression, where we have high intensity like anxiety, we're going to want to add action, add motion, discharge the energy, bounce through the heels, ground through the feet, shake out the body. When we're in a depressive state on the other side of that spectrum, depression requires action. So is there one small step that we can take, whether that's taking the dish on the counter and putting it in the dishwasher and being proud of that moment and using that as a catalyst for the next one? Next slide. All right. So what the science says, there is a really cool study that I will get into shortly, but I want to talk first about reducing Alzheimer's biomarkers. There is a type of breath practice called resonant breathing, and the idea behind this is that we inhale for 5 seconds and exhale for 5 seconds. This puts us at a certain rate of breath for that time that we're breathing in our resonant breath that helps to decrease blood levels of our beta and tau proteins, what Dr. Piero was talking about earlier, this buildup of plaque-like material and protein that we experience in the body and the brain. So participants who participated in resonant breathing for 20 minutes twice daily for 4 weeks experienced a significant decrease in their blood levels of these proteins. This is one of the most simple ways, without external intervention, with using the tools that we have within our own body to start to gain this benefit, to push our system into a place that is healthier, more regulated, more capable of healing itself. Because the body is so wise. And so when it comes to neuroplasticity enhancement, breathwork can improve cognitive function and memory as well, enhancing learning, memory retention, and recall, our executive function in the brain, and neurogenesis. Long term, when we participate in breath practices and somatic work, we can increase the cortical thickness, that gray matter layer in the brain, and increase the volume, which is just incredible. It wasn't that long ago that we were looking at the inability to rebuild the brain, to build new neurons, to create new ways of thinking, doing, and being. And yet we have access to all of this through a tool as simple as our breath to support us, as we maybe also look at the medical and pharmacological side of things and what would fit best. And in terms of participating in these practices in those middle years, what a better way to counteract or add a preventative practice into your life earlier to set yourself up for success later in life, especially if you've done any gene testing to know, does this run in my family? Is there a high likelihood that I'm going to be in this position one day? It also supports emotional stability and mood, activating that parasympathetic nervous system again, downregulating stress, hormones like cortisol. When we cry, cortisol is released in our tears. We're literally crying out the stress hormone. It is leaving our body physically. It also decreases neuroinflammation, improves mood and behavior, and then enhances quality of life for caregivers. This is not just for those who have Alzheimer's. If you have lungs, breathwork can be for you. While there are some contraindications that we can run into as well, those are typically in longer practices where we might be breathing for 30 minutes, 45 minutes, an hour plus. So a pilot study showed that caregivers who practice heart-focused breathing for 10 minutes a day for 2 weeks had lower perceived burden, reduced anxiety, and improved emotional well-being. That's that shift of, I have to go to work, there's this intensity, there's this stress, I'm preparing for the day, maybe it's caring for a loved one, there's a lot emotionally there as well. Now we have a moment of regulation. There's a piece of coming home to self that happens with this modality. Next slide. So let's talk about some somatic breathwork practices for Alzheimer's symptoms in particular. Resonant breathing that I mentioned earlier, inhaling for 5 seconds, exhaling for 5 seconds, 10 to 20 minutes, 1 to 2 times a day. I always suggest titration with any type of breath practice. Start out with 2 minutes once a week. Then bump it up to 5 minutes once a week. Then get to 10. This shouldn't be another thing that adds stress to your life, right? So we want to make room for that integration to allow time to give ourselves some grace to get to where we want to go, or maybe a more full, lengthier practice. So our resonant breathing is going to reduce the stress, lower those AD bar markers, support memory and sleep. We're balancing the nervous system and slowing the heart rate, lowering our heart rate variability. The other practice is going to be alternate nostril breathing. And with alternate nostril breathing, we're going to create kind of a little hang 10 sign with our hand, our thumb and our pinky sticking out, and we're going to rotate sides of the nose, breathing in and out. So we're going to place our thumb on the right nostril, inhale through the left, close the left nostril, exhale through the right, inhale back through the right nostril, switch, exhale out the left, inhale back up the left. And so you get the idea of what that looks like. If we have a hard time stretching fingers too, choose whatever fingers work for you. You can also rest those middle ones on the forehead. But we're going to want to do this for 5 to 10 minutes daily. This is not stacking every breath pattern on top of each other, but choosing one, right? Or maybe rotating on different days when we learn what these breath patterns feel like in the body, how they impact us, what works, what doesn't, depending on the mood, the moment, and the place we're also in. We might be able to breathe very loud and move through the body in a private place like the home, but if we're in public, we might choose something that's a little closer to home, right? A little less visible externally. And many of these we can do really without anyone knowing. The next is the 4-7-8 breath. We're going to inhale for 4 seconds through the nose. Hold at the top for 7 seconds. Exhale for 8. Nice and slow. We want to breathe this breath without straining. So as we begin, that 4-7-8 cadence might be hard to hit. So we can take that and make it 3, 6, 7. Shorten that count just slightly. Meet your body where it's at. No pushing, no forcing. This should feel good. It should feel soft within the body. 4 to 8 rounds, 2 times daily. This is going to be especially helpful when we're trying to wind down for the evening and sleep, or we have those moments of anxiety where we're maybe choosing to try and discharge that energy first, and then working into a breath pattern to bring us back down to center. The final breath here is box breathing. So if we imagine a square in the front of the screen, we're going to inhale for 4, hold for 4, exhale for 4, and hold for 4, tracing the sides of those boxes, this rhythmic pattern, in typically 3 to 5 minutes. This is going to help regulate emotions, to stabilize overwhelm in the body, and balance both hemispheres of the brain, increasing that mental clarity, giving us maybe 1% more access to that I'm searching for, I'm reaching for, or I don't feel quite like myself, or I'm overwhelmed caring for others. These practices are all safe, non-invasive, and adaptable based on availability. They work by stabilizing the nervous system, improving our oxygen delivery, and calming that emotional distress. Next slide. So again, a little high-level overview of how breathwork can help Alzheimer's symptoms. Things we can benefit from: memory loss, agitation, sleep issues, anxiety and paranoia, shallow breathing, confusion, caregiver burnout. What an amazing list that we get to support. Next slide. So when it comes to integrating breath into daily routines, first off, we want to build consistency. So again, don't go for every day. I'm going for 20 minutes a day, as much as possible. In somatic work and breath work, intensity and duration never equal transformation. We can't push and force our way into healing. So the invitation is softness. It's to be a loving witness. It's to choose what works for you or your family member and start there and build on that. Try practicing at the same times daily to establish a routine. Choose a quiet, comfortable space free from distractions. Turn off cell phones. Maybe light some candles, create some ambiance for yourself. You can use guided audio or video resources. There's a lot available online. I would be happy to support this as well. And so many things that you can turn to, even music, to have a beat, a rhythm to follow with the breath, something for the brain also to latch onto and to guide. And then being able to modify these techniques as needed to accommodate physical or cognitive limitations. We might be breathing faster or slower. You might be expanding the breath, really feeling into the body and allowing some movement to come through. Some somatic tips for working with Alzheimer's patients: using gentle rhythmic movement, rocking, butterfly tapping, bilateral stimulation, EFT tapping. These are all pieces that can help us to connect with body and breath. We can pair breath with repetition, cues, or music, like I mentioned, to help that memory. Anchor in the breath by placing a hand over the heart or the belly so we can feel that energy moving beneath. And then keeping practices short and consistent. Even 2 minutes can help. If the suggestion is 10, start with 5. And then maintaining soft eye contact, platonic physical touch, and co-regulation while guiding breath can be especially supportive to the nervous system. Next slide. So breathwork for caregivers. For resilience, for emotional support, caregivers often face this chronic stress that leads to burnout, health issues, anxiety, depression, immune suppression. And what we want to be in this place, right, is clear, loving, compassionate, grounded, excited to do our work, excited to care for our loved ones, to have this precious time together. And so heart-focused coherence breathing has been shown. There's a 2-week study that was done that showed caregivers practicing this technique for 10 minutes daily experience reduced stress and improved emotional well-being. Inhaling slowly while focusing on the heart center and leaning into gratitude. Maybe you name 1 to 3 things you're grateful for. Connect with that sensation. Sit here with it. Allow it to radiate through the heart. Our heart also has memory. It is a vortex of energy and very powerful, just as the brain is. So leverage that. A morning ritual, 3 minutes of the box breathing we went over to set the nervous system tone for the day. Or an emergency breath, when we hit that overwhelmed state when things are too much. Long exhale. Anytime we inhale, and we double the length of the exhale, we are down regulating our nervous system. So inhale for 4, exhale for 6 or 8. Do that as long as you need to. Come back to center. Next slide. And some final thoughts here. Breathwork is more than a relaxation tool. It's a direct portal into the nervous system and the brain. It has been incredible for me the past couple of years to work with clients to see these things, these changes happening in real time. People finding themselves again, coming home to themselves, finding more capacity and ability within what felt like unrest and turmoil. So please know this is accessible to you and this is accessible to your loved ones too. Incorporating somatic breathwork and mindfulness into daily routines is one of the best strategies that we can use to support ourselves with brain health, in addition to looking at the research about longevity, lifestyle changes. These practices not only aid individuals at risk for living with Alzheimer's and dementia, but they also provide a significant benefit for caregivers. For those with Alzheimer's, it can be a slow decline, reduced emotional stress, and anchor them back into the body when memory falters. For caregivers, it's a lifeline, helping them to return to themselves amidst the demands of taking on these tasks. And while it's not a cure, breathwork is a scientifically supported, deeply human way to bring dignity, presence, and peace to the Alzheimer's journey. So as research continues to evolve, these findings highlight the importance of holistic approaches paired with our traditional approaches, paired with research in the prevention and management of cognitive decline. And on that, I will hand it over to Alyssa to share more about the longest day.
Thank you, Morgan. Hi, everybody. My name is Alyssa Reyes, and I am the longest day manager here at the Alzheimer's Association's Wisconsin chapter. I'm very happy to be here today. Thank you so much, Morgan, for putting this longest day event together. And overall, the longest day is a campaign that's inspired by summer solstice, the longest day of the year, which happens to fall under Alzheimer's Brain and Awareness Month, which is obviously June. So this campaign is all about using that extra daylight to do something meaningful, like today's power panel, although you can definitely host any type of event that you'd want any time of the year. So it's a chance to turn your passion or a hobby into a fundraiser, whether it's hosting a picnic, putting together a pickleball tournament, seeing a family friend that you haven't seen in a while. There are absolutely no rules, and it's just up to your creativity and your commitment to the cause. In 2024 alone, this campaign raised incredible $13 million towards our cause. $3 million of those dollars from our global teams, such as ACBL or Charter Senior Living, and 77% of every dollar raised goes towards our care and support, advocacy, and research projects around the world. So that's how we are able to offer free 24/7 helpline, different services that help those with Alzheimer's and other dementia, as long as they're caregivers in those troubling situations at times. So today I invite you, if you're able to help support this mission, to please consider donating to this longest day event by using the QR code on your screen. That will take you to Morgan's landing page to help support. But that is what the longest day is. I really appreciate the time today. I know we're a little bit over on time. If there are any questions, please utilize the chat, but I will pass it over back to Morgan to conclude.
All right. So if anyone has any questions, feel free to drop those in the chat now. There is also obviously the option to reach out via any of the resource lines that Virginia or I have mentioned, or to myself if you have questions about breathwork and somatic work. The Alzheimer's Association is here to support with that phone line as well. And then again, thank you all for anyone who joined today, for being with us. For those watching the replay afterwards, I hope that you find immense benefit in this just about hour-long power panel segment. And again, we are always here to support you. Remember that no one is alone on this journey, that this is a part of the human experience. And although it is tough and challenging, there are resources, education, support, people that are in your corner, ready to help you, ready to bring clarity and take the next step towards the future, whatever that looks like, whether that's with medical intervention or something else entirely. So again, thank you all for the time today. Virginia, Dr. Piero, Alyssa, this has been fantastic. And I wish you all the best in healthy living and brain health and health for the body. Until next time.